Hemorrhoids are a very common condition that many people will suffer from at some point in their life. There are two types of hemorrhoids, external hemorrhoids and internal hemorrhoids. The type of hemorrhoids that we treat are internal hemorrhoids. So they stay, or hopefully will stay inside the body. When they get more severe, sometimes they can slip out of the body. There are two types of hemorrhoids. There are internal hemorrhoids, which originate from inside the rectum, and then there are external hemorrhoids, which are external, as in they're visible outside of the rectum. The best way to prevent internal hemorrhoids is just by having good practice of not sitting on the toilet for very often or a long period of time. External hemorrhoids are painful, generally speaking, and internal hemorrhoids are painless, generally speaking. When internal hemorrhoids become more severe and they start to protrude out of the anus, they can cause a lot of bothersome symptoms such as itching or leakage of fluid, and they can be very uncomfortable for most people to have to deal with. Hemorrhoid artery embolization is an emerging treatment for internal hemorrhoids. The other treatments for internal hemorrhoids, the surgical treatments, are generally painful and will involve significant downtime with recovery. The hemorrhoid artery embolization is an outpatient technique that we use to block off the blood flow that is feeding the veins that are causing the hemorrhoids. Patients will show up to our outpatient procedure clinic, have an IV started, speak with our anesthetist, and then go into the procedure room to get the embolization done. We will put a small catheter, which is more like an IV, into the main artery in your groin, and then position it inside the arteries that are feeding the internal hemorrhoids. And we will do what's called the embolization, where we block off the arteries that are specifically traveling to the internal hemorrhoids. And we will use either coils or particles, sometimes both. And the procedure takes about an hour. Afterwards, patients will come back to the recovery room. They'll recover from the anesthesia. And then when your hour is up, we'll get you up and walk you around, make sure you're feeling okay, make sure you're not having any nausea, and you'll be able to go home. After your embolization, you will be able to go back to work 2 days later, which is much better than the traditional surgical solution for this, which is a hemorrhoidectomy, which will require weeks of recovery.